Hi, this is Dr. Kometz, and I want to talk to you about some homework today, what you want to do after your adjustment. The first thing to understand is the only condition that we correct in the office is subluxation. Most people come in here with low back pain, neck pain, headaches, whatever it is, but the only condition that we're concerned with is subluxation. And a subluxation is a condition where the vertebra that's supposed to protect the nerve under stress, that bone shifts backwards, and what it does is instead of protecting the nerve, it starts to interfere with that nerve. Now, there are devastating consequences both biomechanically and neurologically when this condition happens. Now, if your condition, your symptom that you're coming into the office is caused by this subluxation, once this is corrected or reduced, you're going to start to feel better the way that you want to feel. So I want to explain real quick biomechanically what's happening. The first thing is when you have a subluxation, the vertebrae must misalign. That is the first criteria of a subluxation. And this is something that we can only see on X-ray. So understand, just the mere presence of a misalignment does not mean that the person has a subluxation or that you have a subluxation. It means that there is a misalignment. And that's why we use the instrument to confirm if there's any. We use the instrument first, but we use to see if there is any pressure there, and we confirm it with the X-ray, the misalignment there. So understand that's the first criteria, is the vertebrae misaligns. But what we're doing is we're picking up that interference with the delta T or the nervoscope. Now, biomechanically, what happens at this point is two things. Number one, a misaligned vertebrae. The second aspect of a subluxation that we have is reduced or restricted motion. When a vertebrae cannot move, few things happen. Number one is the only way the discs get nutrients is by imbibing fluid. They must move. So when this happens, that disc starts to shrink up when it's not getting any food. Anything that's not eating is not getting, is going to degenerate over time and get smaller. So when this stops moving, it's not imbibing nutrients. Since there's no blood vessels here, it starts to shrink up. But the second thing is, when this vertebrae subluxates and restricts motion, the vertebrae on top has to move more. So when something is moving more than it's supposed to, of course it's going to wear out the joint. And a quick understanding of this is when you sprain your left knee, you limp on the right knee, nothing wrong with the right knee, but if you keep limping on the right knee, it's gonna continually get worse and degenerate. That's because of the body is compensating. So those are the devastating effects that can happen biomechanically, obviously degenerative disc, degenerative joint, but the cause is gonna go back to subluxation. It's where you find nerve interference with the instrument, and we find that misalignment of the vertebrae, and there's the other criteria that we use, including lack of motion. Now the second thing is neurologically. When you have a subluxation, which you're finding the interference with the nervoscope or the delta T, and you're having the vertebrae misaligned, it's something we're seeing on the X-ray, it's interfering with the nerve signal going into organs. So that's why when you come in, you may come in for back pain, but you may be also suffering from hemorrhoids or constipation. Well, the nerves also innervate organs. So now, when you interfere with the nerve signal going into the organs still work, just not as well. So you can still poop, but now you're constipated all the time. So the goal here is, again, not to correct the constipation or whatever the symptom is, it is to correct the subluxation. So that is the first part. You have to understand exactly what we're correcting. We're correcting subluxation in the office. And chiropractors are the only people to do it. Many people can treat your back pain. You could do it with drugs, you could do it with nutrition, you could do it with surgery, whatever, but we're the only profession that corrects subluxation. That's what makes chiropractic so indispensable.